Thank you for having me. My name is Sanghyun. I'm the academic dean and the faculty in the Wongu University. Today I would like to present the Oriental Medicine for the lupus. So I'm going to explain more about the basic theory of the Oriental Medicine and some of the suggested the diagnosis and then treatment. In addition to it, we would like to give the nutritional the suggestion and then some of the exercise so the people so the patient can try the nutrition and the exercise at home for the maintain the pain from the lupus. The background. The reason why I'm presenting this presentation is in effort to decrease the pain and other symptoms. Many people, including those with the systemic lupus erythematosus, and which is the integrating the complementary medical modality into their healthcare. So in addition to the conventional medicine for this, the manage the symptoms include the pain. This integrating the complementary the modality can be helpful for the lupus community. In the Oriental medicine is not limited to some certain culture or certain countries culture as well. Basically, what the Oriental medicine is the balancing all the 12 organs, including the heart, stomach, or the kidney, and for the lupus patient, the two main organs that we are targeting is the spleen and then kidney. And the Oriental medicine is how we can approach the internal medicine from the outside the stimulation. So all this the colorful line on the surface of the body, which each one is called a meridian. We have mainly 12 meridian on the surface of the body, and each meridian is related to each different organs. So when you see on the left side near the scapula, the zigzag pattern is called the small intestine meridian, and another the green color on the shoulder, and this one is called the large intestine meridian, and another one is the triple burner meridians as well. Oriental medicine, one of the basic theory that we utilize in the daily practice is called the six pattern or the climate theory. That is very similar to understand our the weather. So when we think about our the weather on the outside, we think about the temperature, whether it's too hot or too low, too cold, and humidity, which is the too humid, just like Florida, or too dry, just like the Vegas here. And the wind, which is the atmospheric pressure difference from the solar irradiance, whether it's so windy or the stationary. So based on the understanding the weather, we are thinking about each different organs or each different part of the body. We apply these theories. So like a heart is so cold, so hot, or the stomach is too cold or too dry, something like that. And another basic theory is the yin and yang theory, and it also further differentiates into the four type theory. The terminology is about the big yang or small yang, big yin and small yin. But it can be very philosophical. So we can also make an example as the season, 4 seasons. So somewhat like the spring season, which is the more uprising and getting more warmer, which can be regarded as the big yang, which is the uprising energy. And during the summer season, after the tree grows up and make the more the branches and flower, isn't it? More the dispersing to the outside, and we regard as the small yang type energy. During the fall season, after it prospered all the flowers or the leaf, and then fall season is the moment that like a shrink and converging, isn't it? It belongs to the big in type, the energy movements. And during the winter, most of the energy and essence is going downwards back to the roots, isn't it? To be more prepared to endure this very cold and dry winter season, to prepare for the next spring. It can be regarded as the small in type the energy movement. So based on the yin and yang, it further differentiates into the 4 different types of the yin and yang, the energy movement. And this portion is from the Dr. Han in the South Korea. So after we go over the herbs and acupuncture, I would like to introduce the Dr. Han's the summarization of the 4 type, the nutrition suggestion. The Oriental Medicine diagnosis and symptoms. There can be various different types of the diagnosis, but based on the common symptoms of the lupus, we can suggest in this seminar, I can address about the 3 different possible the diagnosis in the Oriental Medicine. The first one is the toxic heat. And most of the main symptom can be more chest oppression symptoms or the severe thirsts or the seizure can be. If those 3 the symptoms are more the keyword, then we can also relate to the toxic heat pattern in the Oriental medical diagnosis. Second one is the in-deficiency heat. So some of the deficiency pattern and in style with the heat. So some of the possible the symptom can be the hair loss or the dryness or the insomnia. Those symptoms are more prevalent, more dominant than other symptoms. Then we can regard the patients, lupus patients, the Oriental medical diagnosis as the in-deficiency heat pattern. The third one is the spleen and kidney deficiency that we addressed on the previous slides. If the lupus patient is undergoing this pale face and severe fatigue and low back pain, and then knee pain is more prominent than other symptoms, then we can regard this one as this patient's Oriental medical diagnosis as spleen kidney deficiency. Based on this, the Oriental medical diagnosis, the Oriental medical doctors is thinking about what kind of the herb formula will be more suitable for each different pattern diagnose the patients. So to clear heat, the toxic heat, which is the toxic heat pattern the lupus patient, we need to clear the toxic heat. So the herb formula start with the X can be the suggestible. And if the patient's undergoing the in-deficiency heat pattern, then the next step is how we can tonify, make it strong, make the in to be more strong. Then we are thinking about the herb formula that starts with the Z. And then the third suggested the diagnosis was the spleen kidney deficiency pattern, wasn't it, on the previous slide? Then we are thinking about how we can strengthening the spleen and kidney, which is called how to tonify the spleen and kidney. Then we can think one of the common herb formula is it starts with the S on the slide. And in addition to it, for the arthritis, we can think about utilizing the pine tree branches or the leaves as well. Oriental Medical, the treatment, the herb example. On the previous page, we were talking about some herb formula start with the S or the start with the Z, isn't it? The herb formula means the mixture, combination of the few different single herbs. And in the Oriental Medical, the master program that we offer, we learn about the acupuncture and herb. And when we think about the curriculum, we learn more time on the herbs than acupuncture, because we learn the individual, the single herbs first, and then we start learning the herb formula after that. So when we try to understand the herb formula and what is the function and what is the caution, then we need to be more carefully review what kind of the single herbs is in the formula. And one of the herb example is the Huanglian. And some of the formula include the Huanglian on the previous slides. So I addressed the Huanglian as an example, which is called the Rhizoma coptitis. And common English name is the Coptis rhizome. And the property is the taste is bitter and its own temperature is cold. And it's entering the targeting meridian is the heart, large intestine, liver, and stomach. And the standard dosage is the 1.5 to 10 gram. So based on this, the entering meridian means that it doesn't really go to that organs, but some of the function, the effect is more relevant to this organ on the list. And in the acupuncture program, we learn the single herbs in this way, the taste, temperature, and then link to the action and indication of this single herb, which is the Huanglian example in this page. One of the first action is the clear heat and drain dampness from its own temperature, the cold temperature that the Huanglian has, isn't it? So the indication and symptoms is the damp heat in the stomach or the intestine with the diarrhea, dysentery disorder, enteritis, vaginal infection, and cholera, etc. And stomach heat with the vomiting and or the acid regurgitation, like acid reflux, can be relevant symptom to think about the Huanglian, the single herb. And next one is the drain fire and resolve fire toxicity. Probably this is the main reason why we use the Huanglian for the lupus patients, isn't it? Heat with the blazing fire, which is the toxic heat with the high fever, and the high fever is one of the keyword to differentiate the diagnosis in the Oriental medical theory, isn't it? May possibly include the irritability, disorientation, delirium, etc., and red tongue, and then rapid and full pulse. Tongue quality, shape, and the texture, color, and the distribution of the color is very meaningful in the Oriental medical diagnosis. And we are checking about the 6 position on the wrists, and sometimes we check the comparison between the neck and the wrist, the pulse difference also, to get to know about this, whether each organ is in the balance situation. So the pulse and tongue, the diagnosis is very meaningful in the Oriental medicine. And the heat from the excess with the toxic, painful, red eyes, otitis or sore throats, and the malar, the hot flush is also one of the common keyword from the lupus community, isn't it? So probably that's why the Hwanglian is the one of the kind of very possible example for this on this presentation. This is the very important portion because it's very easy to find the benefit or the effect of each single herbs or each formula or the supplements. But in the Oriental Medical, the master program, we also very equally emphasize the contraindication and caution, incompatibility, and herb drug interaction, because before we think about the effects, the safety should have the higher priority for the treatment, isn't it? So the contraindication of the Hwanglian is with the yang deficiency or the colds. So we just saw the three-dimensional axis on the previous slide when we talk about the weather, the theory, isn't it? So whether the patient's own the climate is too hot or cold or too humid or dry, too windy or too stationary, whatever the condition the patient has in this pattern, the main goal is to bring the patient to the neutral, the 0 point, the balance status. So when we're using the Hwanglian, which is the nature is very cold, to the patient who already have a very cold pattern, the cold condition, then Hwanglian will make the patient's cold condition to be more worse. So it doesn't really bring back to the zero. It becomes more farther from the zero, isn't it? And the contraindication to the qi and blood deficiency and stomach deficiency cold as well. So this is some of the contraindication example. So in the master program, when we study, we also get to go over each detail of what kind of contraindication each single has. So what kind of the condition we need to be avoid. This is very important part. So this is how we can give the suggestion, more appropriate suggestion of the herb to each patient, isn't it? The Hwanglian. This is one of the sample slides that I'm teaching in the herb class. Currently, I'm teaching the herb introductory and one of the herb class in this fall quarter, and previously I was teaching the Oriental medical terminology. So in addition to the nature, character, and function contraindication, we also in the master program we also learn about the Chinese character and its own meaning. The Hwanglian, which is the Coptides, the rhizoma. The Hwang means the yellow. When we see the Hwang, the Chinese character, it is from it is based on the farm, like a corn farm that looks like a very yellow, isn't it? So it is based on the color of like a farm. And lian means on the bottom side of the Chinese character means walking slowly. On the upper right hand side of the Chinese this part means cart or car. So it makes us to remind about it makes us to image the very much like some traffic, just like a Monday, like a 9 a.m. the traffic on the freeway. Every car's in a row, just like this photo, and they drive slowly, isn't it? Because the Huang Nian is actual the form before it's got like a prepared to be this the herb the to be this the herb in the herb dispensary. The right side is the how it looks like after it cuts and the processed. The left side, right next to the all the long line of the car, it is the actual shape of the Huang Nian. It looks like a small cart is in a row, isn't it? They're like driving slowly. So this Huang Nian, the Chinese herb, is based on its color, which is the yellow, and then the lian, which is the long line of the cart shape. So some of the herb is based on its shape and color, and some herb is own name is originating from its action uh, or is the effects too. So on the right side is the bitter taste, the cold temperature goes to the heart or the large intestine and liver meridian, isn't it? Which is the Oriental Medicine in addition to the herb. Mainly the school clinic and then local the acupuncture clinic, they offer the acupuncture and moxibustion and cupping. The acupuncture the needle is thinner than hair, so during the treatment it's not so painful at all. And the acupuncture the needle is stimulated on the specific the acupuncture points to give the effect to the brain and goes to the each designated the organs and then part of the body as well. And the second one in the middle, the photo in the middle is called the moxibustion, abbreviated as the moxa. This is the very similar to the short cigar with the safety panel, so it doesn't burn the skin, but it warms and brings the herb oil near the acupuncture point to give more the stimulation and the increase the temperature as well. The third image is the cupping. When we think about the cupping is the opposite effect of the acupressure or the massage. When we get the massage or the acupressure, it is directly disrupt the local soft tissue, isn't it? By squeeze in, by the giving more the pressure. But the cupping is opposite. Reduce the pressure, increase the volume to have a more empty space on the deeper tissue level. So that's how we can reduce the pressure and then tension on the local area. And on this slide, I mentioned about the two clear heats, moisturize the dryness, because we used to mention about the dry or the heat, isn't it? So possible some of the one of the suggestible the combination of the acupuncture point DU14 means the Du meridian 14. In addition to the main 12 organ meridian, there are two more meridian which is running vertically on the front side of the midline and then back side of the midline. So it is running on the top part of the the center of the vertebra on the vertically. It's called the Du meridian. We abbreviate as the DU14. And then LI11 means it is the large intestine meridian acupuncture points at the 11th acupuncture point. So we can imagine about the freeway. When we drive the freeway 15, there's an exit number 39 or exit number 26, isn't it? So you can imagine about the freeway, which is called the large intestine, and it is the 11th exit. Each acupuncture point has their own the location and function and the meaning of the each name. This the LI 11 is especially for the clear hits. That's why it is included in this the suggestible the example. Another one is the ST36, which is the stomach 36. Stomach meridian on the stomach meridian line, it is the 36th acupuncture point, which is located on the 3-inch below the inferior border of the knee on the front lateral side. So that acupuncture point is very helpful for the spleen and stomach, the tonification, and spleen number 6 as well. So on the right side of the image, we talk about the each like a colorful line represent each different acupuncture, each different organ, isn't it? And small dots, and there's a small like a font, the Chinese name, isn't it? Chinese name and then number. So this one represent each the acupuncture point name, function, location, or the meridian they belongs to. I found that the previous the research study is done in the Pittsburgh. Acupuncture for the lupus pilot the study, the feasibility and safety study. In summary, the acupuncture may be helpful, maybe useful non-pharmacological methods for managing the pain for the patient with the lupus. I found the case study in the South Korea, the clinical report of the lupus. So they treat one case of the lupus patient with the Korean herb medicine, acupuncture, and the moxibustion. So after the treatment with these the Oriental or the other herbs, and then the GV20 or CV12, those kind of acupuncture point combination, and in addition to it, they also inject the pharmacoacupuncture, and after the treatment, they recover from the formerly urine, reduce the general body weakness or the arthralgia. So this also suggests that the Korean medicine, which is the Oriental medicine, have a significant effect on the reducing symptoms of the lupus. Oriental medicine, the body type, yin-yang, and then four type. This yin-yang, the philosophical the concept can be applied to the physiology also. And this yin-yang theory can be further differentiated into the two different yin and two different yang. The two different yin is the small yin and big yin. Two different yang means the small yang and then big yang. This the big yang called the tai yang in the Oriental medicine, which is relevant to the lung function. Small yang is the terminology is the Shaoyang, which is relevant to the spleen. Big yin, which is called the Tai yin, is relevant to the liver. And then Shao yin, which is the small yin, that is relevant to the kidney. It can be applied to the sodium potassium pump. For the yang type people who's when we think about the four organs balance, when there's a group of the people whose the spleen's function is more stronger than other organs, then there the absorption is very strong, and the sodium potassium ATPase the effect is also more stronger. So because of this condition, the sodium the sodium tend to be on the blood plasma. In the opposite, there's a in-type people, like some group of the people. There, the strong organ is the kidney, and which is governing more the excretion, not the absorption. Then the sodium potassium ATPase is there. The effect is tend to be weaker, so the sodium tend to stay in the cell. So for the young type people who already have a high level of the sodium on the blood plasma, then we can recommend the reduce the sodium intake to the young type people because they have enough the sodium level. Opposite way, for the in type group of the people whose sodium is in the cell relatively low in the blood, then we recommend to increase the sodium intake to have a balance. This fourth type is relationship between the human and foods, the diagnosis and the treatment. So for the yang type people, we give the in type foods to have a balance. For the in type people, we give the yang type foods to have a balance. So yin yang is further differentiated into the four different yin yang, isn't it? Thai yang patient, we give the Thai in food. Thai in patient, we give the Thai yang food. Small yang patient, which is called the Shaoyang patient, we call the Shaoyin types of the food. Shaoyin patient, we suggest the Shaoyang food. And Thai yang type means more like the upwarding and dispersing, just like a kind of wood. Wood in the five element. Five element theory is also one of the fundamental, the basic, the theory, which is also we tend to have more the dry and the warm. It doesn't represent the actual the wood, but it represents the energy vector that is more the upwarding vertically. So because of this, the energy, the movement tendency, the body type is mostly on the head, body parts, mostly on the head and neck, and chin is going up. Upper jaw is more developed than lower jaw, and hearing the sound is very well developed, and the lung function is also very strong too. And some of the example, the animal is this one, then plant tree is this, and fish is this one too. The Thai-in type, which is the opposite, isn't it? So energy is tend to have more converging or to the inwards. So just like a vine or it also goes like a downwards too. Tend to stay and waist when we think about the patient's the body shape, the waist is very high, neck is short, strong inhalation and strong the smelling too. So the upper abdomen or the waist is more developed than other people. But everyone has an exception, isn't it? Some people like if they eat more or they do the exercise more on this part can be more developed even though they don't belong to the Thai-in type. There must be like other exception. That's why we collect as many data as possible to reduce the percentage of the error. So this is one of the example of the animal and plant and then fish as well. Shaoyang type, which is the summer season, isn't it? The hot and mostly at the shade area to have a balance by itself, isn't it? Tend to act and tendency to move around. And when we think about the patient's body type, the chest part is more developed and the eyesight is more developed and hip is low and tend to have a keep on moving just like this fish on the right side, and fish without the scale. Head and wings are the way more developed than other parts. The Shaolin type tend to have a cold and vine also, another different types of the vine also at the warm, and tend to the survive in the dry area and tend not to move and very passive. Develop the tastes, tastes is very developed, and more frequent urination excretion is more developed. When we think about the patient's body type, patient's body parts, then the lower jaw more than the upper jaw, and abdomen, hips are more well developed than other parts, than other the neck and shoulder, isn't it? So, but weak neck and shoulder. So this is some example of the plants, animal, and the fishes. The four type theory, especially when we based on the Dr. Han's the clinical experience, when he diagnoses differentiate this the four type, when the Dr. Han differentiate his patient into the four different group, which is the tie-in group, the fall season type people tend to have the lupus, is more the vulnerable to the lupus. The food therapy according to their own type. So not only this the acupuncture or the herb, and we also recommend some certain group of the food that is more suitable for the each different type. So we're gonna go over the food in the future too. And mostly the in type patient, especially the tie-in type, fall season type, from the lupus, from the inflammation in the lipids metabolism, overreaction, and it is regarded as the autoimmune disease. Depends on the people, the efficiency of the metabolism of the types of the foods or the meats are the different. Some, for example, some people can digest the pork very well on the left picture, but the others doesn't. The four type theory, the lupus patient mostly need to avoid the pork or chicken, but we can recommend more beef. And we also recommend to increase the salt intake because they belongs to the in type, isn't it, on the previous slides, to prevent the rotten the lipids. So the pathological process is that when we have a low level of the salt, it means the increase the potassium, the relatively increase the potassium level, decrease the sodium. It triggers the inflammation. And we need to reduce the urination. So we suggest the lupus patient to drink the water 15 minutes before the intake the salty foods to prevent the urination within the 1 hour. And we also recommend to avoid the caffeine to reduce the urination, include the green tea or the coffee. One of the factors associated with the lupus is the vitamin D deficiency. It's from the Wikipedia. So we also recommend the vitamin B3, 6, or D, or the magnesium, or the yam, or the progesterone too. And based on the Dr. Han's the clinical the experience, some group of the people like a treatment can include the corticosteroid anti-malarial drugs. Some types of the lupus, such as the proliferative, the glomerulonephrosis, require the intermittent cytotoxic drug. This includes the cyclophosphamides and the mycophenolates. Cyclophosphamides increase the risk of the developing the infection, pancreas problem, high blood sugar, or the high blood pressure. And it might be because of the and based on his explanation, experience might be belongs to the because of the patients belongs to the Shaolin type, which is the winter type patient. And hydroxy the chloroquine was approved by the FDA for the lupus. In terms of the healthcare utilization and costs, one study found that the patients from the US with the lupus, especially individuals with the moderate or severe disease, utilize the significant healthcare resource and incur the high medical costs. Probably I assume that everyone also experienced this situation, isn't it? And the Dr. Han also study the previous the patients the diclofenac on the upper side of the image is was more suitable for the yang type patient, and indomethacin was very helpful for the group of the patient who belongs to the tie-in type. For the fall season tie-in type, we also the Dr. Han also suggests to include the Baijiu, Gaoben, or the Sangbai Pi, Sudan, or the Waiting Shen, the Fuping, or the Sangzhi. Can be very relevant to the tie-in type, the lupus patients. The hot flash is one of the common symptoms of the lupus, isn't it? Is from the, in his understanding, is from the vasoconstriction. We need to induce the sweating on the forehead and chest, include the clapping, fists above the head, and then cough exercise. The cough, the lower leg, is also regarded as the second heart, isn't it? So, let's practice this one together. Where we move the ankle up and down. So we are utilizing the calf muscle, isn't it? So while we're continuing using the calf muscle, we can clap and we can bring the fists together on the chest level above the head level 4 times or 8 times, 4 times clapping and 4 times putting the fists together. So this kind of exercise can be helpful to induce more the sweating, especially on the forehead and chest. So we need to do this exercise with the bigger range of motion, isn't it? Utilize more the shoulder and neck as well. So based on this differentiation of the 4 different types of the people, then we can also and we assume in our the 4 type theory, the tie-in type, which is the big in type, the people are more or they are having more tendency to have the lupus related symptoms. So we tend to suggest the yellow highlighted group of the foods include the grain, wheat, adlai or bean, vegetable, bell flower or the water parsley, sweet potato, mushroom, the shiitake. The seafood is the kelp, and the meats, so we suggest to avoid the lamb or pork or the chicken, but we suggest the beef or the dairy. The fish, mackerel or the hairtail fish, is more suggestible based on this theory. And the fruits, banana. Banana is enriched with the potassium, isn't it? So we tend to suggest reduce the banana intake, but we recommend more the plum or the watermelon. And then tea also supplement the vitamin B6 or the B12, alcohol more the plum wine. So this is the Dr. Han's explanation about the 4 type theory parts of in this presentation. So for further information, if you'd like to get to know more about the acupuncture, moxibustion, cupping, herb, and the exercise and the nutrition suggestion, feel free to contact us and make an appointment in the Wongu Health Center, which is the phone number is on the page. And then if you're interested in more the further the education, the master program, we also can have give more the information as well. So yeah, so in this the presentation, I wanted to share the what we're thinking, what kind of things we can do, will do to the lupus community based on the Oriental medical theory and especially the yin and yang, the six pattern, and then the meridian, the 12 organ theory, and then four type theory. So that's all I wanted to say so far. So thank you for inviting me, and then hope that I can continue the communicate with you. Thank you. So far we have been covering the Oriental medical, the basic theory, the yin-yang theory, four types or the six pattern, and we also review about the acupuncture, herbs, and then cupping or the moksal, and the food suggestion as well. So if you're also interested in about the school, the clinic, and more the further education, please feel free to reach us. Thank you.